Is the prostate the male G spot? Well, let's unlock some facts about that. Welcome back to the podcast with me, your host, Dr. Deborah Durst, and my co-host.
Hey guys, Faraday Golombieski, family nurse practitioner here at Revitalize MD. And today we are going to talk a little bit about prostate and prostate massage. So Dr. Durst, what is the prostate?
Well, that's it is an interesting topic. It's a small gland with a big impact, right? So
that's what they say.
Very impactful based on what we're actually talking about today related to is sexual function, but also it's such a small gland, but plays a big role in, function for men and everything that comes from the male genital urinary tract, but also even cancer. So it's a small gland, but it has some big implications for men. So basically the prostate sits at the base of the bladder and it's there to basically nourish like sperm. So
Yep.
You basically, in the testicles, the sperm are formed, and then it travels up, and then through the seminal vesicle, they arrive together, go through the prostate, and the prostate helps to nourish that, form the ejaculate, and then pushes it out through the urethra. And so that plays a huge role. And so now, because you can get to that prostate, and any man that's had a prostate exam knows what that is, you go through the anus to fill the prostate. And really the only medical reason why we're doing that is just to get a feel for that prostate. And is there a cancer? Is there nodularity? Is it bulky from a prostatitis? But then what we're going to talk about today, is there a reason why people are doing that same procedure, but for sexual pleasure? And then what has been the history of what we've done with the prostate over time?
And is there a health benefit or is there not? We get patients that ask us all the time, should we get prostate massage? Because I think there's a lot of misinformation out there. So we're just going to break that down today and talk a little bit about it. Like Dr. Durr said, the prostate helps with nourishing the sperm. It helps with urinary flow. It is also full of nerve endings and can be very pleasurable when manipulated.
Yes. Well, and as we know, as men get older, they have enlargement of the prostate. So again, about 50% of men over the age of 60 will have enlargement of the prostate, and it can just be benign and not cancerous. We know that happens. And so what we want to talk about is, how common are there issues with the prostate, and does it help with orgasms for men? Because that's the big question. Yeah. And we've had a request for this podcast in particular on our YouTube channel. So Here it is.
So common issues with the prostate are prostatitis, which is inflammation that roughly affects and is treated by about 8% of men through the urologist. Like Dr. Durr said, about 50% of men over the age of 60 have an enlarged prostate or benign prostate hyperplasia, which is just a fancy word for an enlarged prostate that doesn't really cause them any problems. Prostatitis, however, is an inflammatory process of the prostate, which can cause some issues.
Yeah, and it can cause big issues. So in doing ER for greater than 20 years, it was a very common thing that men don't get a lot of urinary tract infections because men have a very long urethra, where women have a very short one. So bacteria can ascend from the outside or the vulva for women. But for men, because it's protruding as well and easy to keep clean, that in the urethra is very long. So you don't usually get bladder infections or prostatitis. Those urinary tract infections aren't as common, but it does get more common with age and with the enlargement of the prostate. And so we would get men all the time with urinary tract infections. And if they had a prostate involvement or prostatitis, that could be a huge issue, because then if you're doing any kind of prostate massage, so there's a chronic and there's an acute prostatitis. And so acute is a problem, chronic is not as much a problem. So meaning that acute is when you don't want to do any kind of prostate massage. because you can actually potentially seed bacteria into the bloodstream. And so take a urinary tract infection or prostatitis and make that now a bacteremia and sepsis and worsening. But if you have chronic prostatitis, that's where actually it's played a role in medicine over the years, since the early 1900s, where if they had symptoms of chronic prostatitis, which would mean maybe you're having trouble urinating, completely voiding, your bladder,
heaviness
feels full all the
feeling.
time. Yeah, heaviness. That all of that was potential. Why they were doing it is they were massaging it for chronic prostatitis in hopes that it would release some of those symptoms that they had.
Release some of that fluid that is in that gland and reduce inflammation. That was the hope. Now, this was also less common in the U.S. and more common in China and Russia. But like Dr. Durr said, it's been around since the 1900s. So it's not a new practice. Yeah. It's been around a long time. So there's a lot of data behind it when you're looking at urological studies. And I think that's really important to note as well.
And it was, again, in the 1900s, more common, though, China, Russia, not as common in the U.S. for somebody to do a prostate massage.
I love that your finger keeps coming
up. I know.
Up.
Well, I did a lot of rectal exams in my day. And I would actually, when men, just as a funny side note, when men would look and be like, oh, you got to do a rectal exam. It's a hated thing. And now you're in the ER and you have a urinary tract infection. I need to do a rectal exam. And they would be like, oh my God. And I was like, listen, at least I have small fingers. So it
could be a lot worse.
So it could be a lot worse. This will go well and quickly. So, but anyhow, that's why I keep doing that. So, but building up that inflammation, basically a relaxation of the tense pelvic floor that goes along with it. And that's what, just increasing circulation and decreasing inflammation was the thought of what a prostate massage would do in chronic prostatitis. But then it really has been abandoned because it hasn't really been shown, at least from a medical standpoint, to be any more effective than just an antibiotic alone at treating something. And so that's why.
Yep. There was a study in 2006, and it looked at prostate massage alongside an antibiotic and then just patients on just an antibiotic, and there was no significant benefit or any reason to really do the prostate massage. There was no statistical implication that it would be beneficial in any way, shape, or form. So that's where Dr. Durr says it's really kind of been abandoned on the medical side, that there really isn't a huge reason to do prostate massage unless we're trying to get some of that fluid expressed from the prostate gland to then do a culture on it. But outside of that, there's really not a reason for treating of prostatitis. An antibiotic, if needed, works just fine.
And that's probably more of an academic point than anything else and not real world application, because I will say that I don't think I've ever, we would basically almost assume if they had a fever with it that they had, a prostatitis along with it, because it's not common for men to get urinary tract infections. But a urinalysis will usually reveal with a culture whether the back, and I don't know, I could be wrong, maybe the urologists are doing that but I doubt it. Just rectal exams are probably not expressing. So
we weren't really doing it in primary care. You're not doing it in the ER. I think that's more urology.
Academic probably, learning, but then probably not actually done, not for that reason. So yes, I think we've abandoned prostatic massages almost probably across the board. Let us know if there's something we're missing there.
Maybe there's a urologist out there listening to us going, ladies, you're wrong. I do get cultures for this. And so please educate us.
No, but that would be the only thing, because pretty much you're not going to a medical clinic if you want one. And you don't want to do it in acute prostatitis. Hasn't been shown to be effective in chronic prostatitis with all those symptoms. And so not done by medical providers. So the thing that remains is, does it help with sexual function? And does it help men and increase their orgasmic strength? And is it the G-spot for men? And that's the question, I think, that remains. And the only reason why somebody would do it, and then, there were questions of where would you go to get a prostatic massage? And given the information that we just presented, that would be home.
That would be home. That would be you and your partner.
Yes.
And that's really, that's the truth behind it. And is there pleasure for men with prostate massage. So we know that the prostate is full of nerve endings. So it would make sense that prostate massage would be pleasurable. And on a study that they did is looking at, is prostate massage, does it lead to a stronger orgasm? Is it more pleasurable? One of the surveys they did, it was 33 to 40% of men who tried prostate stimulation reported stronger orgasms. And it is often referred to as the male G-spot because, like women, the G-spot is full of nerve endings.
Yeah. And I think that across the board, like, you may hear a lot of like the anal stimulation, maybe even we talk about that for men versus like a prostatic massage of going inside versus just on the outside, whether we look at that comparison and see if there's any like surveys they've ever done. But it does look like a lot of men, greater than a third of them do report
it.
increased orgasms. And again, these are going to be surveys that you're depending on. And so, but those are done by partners. There's obviously toys that will do similar things. And I think so you find out whether it works for you. And then it would be helpful if you find it reduces the symptoms of a chronic prostatitis with all the urinary tract symptoms, then that might be something that you want to continue at home and by you or your partner or a toy. But otherwise, the time that I would say absolutely it's off limits is if you have an acute infection or you think you do. So you have fever, chills, you have a urinary tract burning with urination,
Or
frequency,
cancer.
don't feel good, and with cancers, yes. And so those would be the times not to do it. But otherwise, I think if it provides you pleasure, you don't have something acute going on, you don't have a cancer there, or it does help your symptoms, it definitely is not contraindicated then.
Yeah. Just use lube, be clean,
yes,
be safe.
yes. And I think
those are the big
irritation,
things.
irritation and infection are the things that you want to. So I would just say with women, there's nails and there can be issues. So you just you don't want to cause some trauma to the prostate. So definitely just be cautious with anything that's pointed or sharp.
Or sharp.
Yes.
That would be the other. There is some notation if you have hemorrhoids that it can irritate hemorrhoids and have irritation there or soreness. So again, if it hurts, you shouldn't be doing it.
Yes.
It's kind of a good rule to go by.
Yes. Well, and again, if you're doing it, probably relaxation, is going to be the key.
Yeah.
Lube will probably help with that. And then just making sure that, you set those boundaries, have those discussions, but you'll find out whether it's right for you. And there's definitely only those couple contraindications, such as the infection,
I think you
infection
made
and cancers.
an interesting point that you said it very quickly and kind of kept going. But if there's a difference between internal stimulation versus external stimulation, the prostate does sit very, very close to the surface of the skin and probably could be massaged through the perineum area pretty easily. I wonder if there is anything out there, if you guys have any feedback.
Yeah, we'd love to hear if there's experience of external versus internal and a difference and what men have to say about that. So definitely let's start conversations in the comments, and then let us know if there's anything else that you would like to talk about, sexual wellness or wellness.